including fecal material, stool belonging to people, and then he washes them, protecting the well. Okay, so it was just an empty well,
Okay.
you know, without cover, without lid. Unfortunately, when it rained, and then there was so much water accumulation, then there was stagnation. Then water was now running on the ground. Okay, and then some of the water was now draining down into
the well.
Okay, now the thing is, you would not know from what source these waters that is running started coming. It's possible it has washed off some feces, you know, from somewhere, and then it brings it and then pours it. So you can see why cholera is also common in the rainy season. So basically, now there's one message in this, that cholera has something to do with water. Okay, largely it has something to do with water. Okay, either people are struggling to get the water, okay, and as such the surviving sources of water are crowded, you know, and then hygiene is compromised, and then eventually the bacterium is deposited there, or the is flooding, okay, and then a lot of fecal material are being washed around and then deposited to our homes, to our sources of drinking water. Then eventually people get infected with the bacteria.
Okay.
So yes, we would say that there are seasons in the year. We would not expect cholera commonly around September, October, when the rains are going, when there's a lot of water in the wells. People are not struggling to look for water, you understand, and then you are not likely to see flooding around that time. So we don't commonly see cholera around such times. But of course, around this time, yes, we do.
Okay, we'll come back to this issue of sources of water, because there are a lot of things that we do with water. So we'll come to find out later. Better now with this elaborate explanation. Now, how fast, you know, can one contact this cholera?
Okay. How fast? As soon as you ingest the bacterium into your system. Okay. It takes just about 5 to 7 days. 3 to 7 days from the time the bacteria enters into the system.
Okay.
Until when the person begins to manifest symptoms. Some don't even take as long as that. Okay? But then averagely it takes around 3 to 7 days. Okay? So usually now I would explain something here. You know, the human physiology is in such a way that everything is supposed to work in a protective manner. Okay, when you eat food, the food has or the food passes into the stomach. Okay, now in the stomach there's acid. We call it hydrochloric acid.
Okay.
And this acid is usually sour in nature. For those who do have a reflux, you do like a belching and then something comes up.
Yeah.
You discover that it is usually very sour in some cases. Why it is sour is because of the acid that is there. Okay, that acid is supposed to be there under normal circumstances. And one of the functions of this acid is to destroy microorganisms such as cholera. Cholera as a bacteria does not survive acidic environments. Okay? Unfortunately, sometimes people ingest these bacteria in such a large quantity. You can imagine you fetch water from a contaminated source. And this is bacteria we're talking about. It multiplies very rapidly. They give birth and become, you know, so plenty, so populous in the. So imagine that just a drop of that cholera inside a body of water. In 24 hours, we're talking about millions of them. Then you drink maybe, let's say, 50,000 of them. And then the acid succeeds in killing maybe 49,000 of the copies of the bacteria. I'm just giving an example, just an illustration. Now, the remaining 1,000 may survive and go down to the intestine. It is when it goes into the intestine that it begins to cause symptoms. So from the time you ingest it to the time it goes into the intestine to the time you start producing what we call cholera toxin, okay, it takes just averagely some days, and then the symptoms begin to manifest. And if care is not taken, from the time symptoms begin to manifest, the deterioration becomes very fast. Okay, so most times when people have symptoms, the symptoms become very severe in a very short moment of time. We're talking about somebody passing 1 liter of fluid in an hour. In 1 hour, you are losing 1 liter of fluid from your body. you know how how big that is. Okay. The whole blood volume in the human body is just about 5 liters. Okay. We're talking about blood. But then overall fluid in the body, okay, is about 42 liters in the body. Now, you imagine you begin to lose this fluid rapidly. Every 1 hour, you are losing about 1 liter. You will lose in the next 5 hours. It is very likely that you are going to be very weak and maybe incapacitated.
Okay.
So you can see where the whole thing is leading us now. But then we will shed more light as we go further in the program.
Okay. Yeah. So one of the things you said, you lose fluid. So what are some of these signs and symptoms that immediately one will begin to see and it predisposes itself?
Okay, signs and symptoms.
Yeah.
Okay, but suffice it again, let me, before I talk about the signs and symptoms, I will buttress again. I want to emphasize on how cholera is gotten.
Okay.
Okay. Now, the route of transmission, you know, there are so many means through which human beings get diseases. We will say one is maybe through genetic means, maybe by reason of your genes.
Yes.
You inherited the disease from your parents. Okay, we call it genetic or hereditary. Okay, then there are other means such as sexually. Okay, we have diseases that are transmitted sexually. We have diseases that are transmitted, you know, even by contact with skin.
Yeah.
Some via inhalation. You just inhale whatever it is, like COVID-19, you know, of that time. Now, cholera is not transmitted through any of this. It is transmitted through one route, and that is a fecal oral route. Fecal means stool, human excreta.
Okay.
Oral means mouth. Okay, so from the stool of one person to the mouth of another person. That simply means this is the mode through which it is transmitted. So how? If a person sheds it off in his or her stool, and then by some means contamination happens, and then this bacteria finds itself into bodies of water, it multiplies there. Or let's assume the person goes, you know, Africans were fond of defecating around. So the person goes around and he sees a mango tree and, you know, he hides there to defecate. Okay, he defecates there maybe 3 or 4 days ago. Then rain fell, you know, and dissolved the excreta.
Yeah.
And then it's now spread on the ground. The mangoes now fell down. Okay, then somebody comes and he sees a very ripe mango on the ground and he carries it and he just eats it.
Use your cloth to just clean
Or
it.
you just use your cloth to clean it. Okay, then you now eat. So it means you have ingested the disease. How did you get it? Through another person's feces. You didn't eat the person's
feces directly.
But somehow you have gotten it from the person's feces because it has dissolved and it has gone around. It has, you know, dissolved and it is absorbed around. Now, you now ingest it. Eventually, it becomes a problem. Okay, so fecal oral route, and then especially drinking water. We are more particular about drinking water because that is where a lot of, because usually when you see a case of cholera or an outbreak of cholera, it's not like COVID-19 that you see it spreading all over the place. You see cholera happening in a community, and if you check it out, you see that this community most likely have one source of drinking water or common source. So they mostly go to the same place to get their drinking water. Okay, so what it means is that place is likely contaminated, and that is why even in the diagnostic workup, sometimes you want to go and test even the water source of that community. Okay, you would want to, if possible, stop people from accessing water from that place until you are able to address the issue of the infection before signs you can talk about allowing people to go and fetch water from there. So now I will now go to the symptoms, the signs and symptoms. There is one symptom that is remarkable, that is very important, and that is diarrhea. Diarrhea simply means passing of frequent watery stool. Okay, so you see a person who goes to toilet every 10 minutes, 5 minutes, 15 minutes, 20 minutes. Okay, and when he goes, he passes watery stool. And when he passes watery stool, it is high volumes of watery stool. High volumes of watery stool. It's not, eventually, somehow we may, from time to time, eat food substances that are not maybe our body does not tolerate them, and as a result, we go to toilet, maybe more frequently.
Yeah.
Then when you go, you now have diarrhea. Then you pass maybe just watery stool. It may not be obviously watery. It may just be, well, watery, yes. Okay, but then you see some small food particles or digested food materials inside. The type of diarrhea you see in cholera, let me use the medical description for it. It's called rice water fever.
Okay.
Now, rice water
Rice.
fever,
The rice that we boil.
the rice that we boil and wash.
Okay.
Those of us that grew in the rural areas, maybe we eat local rice very well. You boil the rice, you wash it. You see that water after washing? That's what the diarrhea looks like in cholera. Okay, it is so watery, and it's just rice water. That is just the description. So it looks like water after washing rice. It is so watery. Then the quantity is so profuse, is much. As a result, it leads to rapid dehydration. It is not the cholera that kills people. Cholera in itself, the bacteria, does not necessarily kill people. But it is a fluid that the person loses that becomes a problem eventually. Because it would surprise you to know that in some cases you don't even treat the cholera itself. The bacteria may eventually die on its own. But the dehydration that is there, if care is not taken from the fluid that the person is losing, the person dies eventually if nothing is done. Okay, so first symptom and the most important symptom is diarrhea. So if you are listening to me and you just discover that you've been passing watery stool, you pass watery stool today, 10 minutes later you pass another one, or 30 minutes or 1 hour, and it is becoming frequent, you are already passing it 4 times. I mean, don't sit down and wait until it becomes too severe. Just rush to the hospital quickly. Let them evaluate you. It may be diarrhea from any other sources, but it's better if you go and they say it's from other sources than if you sit down at home and then maybe it is cholera. Okay, I'll come again. I'll talk about the management, why you should not stay at home.
Okay.
Because it's not the right thing. Then other symptoms. The next symptom is vomiting. Vomiting does not occur in all people. Okay, but there are people who would have both diarrhea and vomiting happening simultaneously. So even if you say you want to keep that person at home to give him ORS, nothing is going to happen, because how do you give ORS to a person who is vomiting? You're going to throw it up now eventually. Okay, and moreover, ORS is not suited for the condition of cholera. Okay, because if you understand what happens, then you're only wasting your time giving ORS.
Okay, but can it be a first aid?
It does not suffice usually. It does not. Okay, so we are going to discuss that anyway. So diarrhea, profuse watery diarrhea, large volumes, very frequent, rice water, kind of diarrhea. Now the next is you may have body weakness. And of course, the body weakness is now explained by the diarrhea, because once the person begins to lose fluid, okay, you are losing fluid, you are vomiting, you are losing electrolytes, the person becomes weak. Okay, eventually the person even becomes unconscious. Okay, then we also have other symptoms like fever. Fever is not common. You rarely see fever. Even if it does occur, it occurs just in children. Okay, so this may even help to differentiate from other types of diarrhea. Other diarrheas may present with fever, but this one not commonly. Okay, very uncommon to see fever in a patient with cholera. So other symptoms, headaches, body pain, loss of consciousness, and eventually, if care is not taken, what we call acute kidney injury, where the person is no longer passing urine. Then you see a person spending the whole day without passing urine even once. It means the kidneys are shut down. The kidneys are like fishes. The way the fish cannot function without water bodies is the way the kidneys do not function in the absence of water. So you can see how important it is. So as you are losing this fluid, your kidneys are already rounding up and about shutting down as well.
Okay, thank you. Yes. So we will take a break so that when we come back, we'll give you an opportunity to be part of what we are discussing in the studio. And you can see we're talking about cholera, and we said it's mostly seasonal. We've established it, the signs and the symptoms, but we want to go in to look at the management and also how to prevent it. So we'll take a break, and when we come back, we'll give you an opportunity to join us in the studio by dialing the number that will be there on the screen. So let's take this time out. Yes, we are so glad that you are keeping faith with us on Healthcare Live from the Plateau Radio Television Corporation here in Jos. And we've been looking at the outbreak of cholera, that so far we have suspected cases, we have confirmed cases, and unfortunately, we've lost some people as a result of the outbreak of cholera. And with me in the studio is Dr. AYUBA NAMANG JEHU. He is a resident doctor, Department of Anatomic Pathology and Forensic Medicine. He is also the Public Relations Officer of the Nigerian Medical Association, Plateau State chapter. So we will open our lines so that when you call us, we'll appreciate to know who is calling. You ask your question, or you also make your own comment. So this number is 0906 19 10 191 0906 19 10 191. So we would love to hear from you so that you can add your voice to it or seek clarification where need be. So before we get any question coming in, from the way you've talked about it, sometimes it becomes a community thing. Okay, let's see who is on the line. Hello, who am I speaking with?
Hello.
Yes, who is on the line?
Hello.
Yes, who am I speaking with?
You're speaking with me.
Pardon, what's your name?
Rejoice.
Okay, Rejoice, from where?
From Country.
Okay, Rejoice, go ahead and ask your question.
Hello.
Okay, Rejoice. Okay, maybe you can call us back because we seems not to get whatever you are saying. So mostly it becomes a community thing, because when it has to do with the source of water, you discover that 1, 2, 3 houses, people are coming down with it. So with this now, what then should the management look like? What should the treatment look like immediately? Hello?
Hello.
Yes, who's on the line?
It's Rejoice.
Okay, Rejoice, go ahead.
My question is that we should stop getting hair from the ground.
Okay. Okay, we should stop eating dirty things from the ground. Hello, Rejoice.
Hello.
Yes, so now that you know that we should not be picking things, especially mangoes, fruits, or whatever from the ground and eat directly. So what will you do to help your community?
All right, this is my question.
Yes, now that you have this knowledge.
Oh, they should stop eating dirty food. That's my advice.
Okay, thank you, Rejoice.
Thank you.
Okay, we appreciate Rejoice. So now, especially now that we have the outbreak, what is the response like and what should people do?
Okay, what the response should be like, I want to see it in in terms of the family, and then the community, and then the government. Everybody has a role in this.
Okay,
Okay, you could go.
okay, let's pick the call. Hello? Yes, who's on the line? Okay, the person just dropped again.
Person dropped. Okay.
Yeah.
Now, at the family level, it is your responsibility, first as the person infected or the person affected, or the first person to develop these symptoms. It is first your responsibility to report these symptoms, first to the family, and then to the community facility, healthcare facility within the community. So you can see that even the person infected or the person affected first has a role. He has a role to himself or herself to stay healthy, one. Then you have a role to also inform the family and then the community, so that if it's going to stop, it should stop with you. It shouldn't spread to others. Of course, I don't think if I suffer something, I would want my brother to suffer it.
Yeah.
I don't think I would want anybody around to also suffer it. So I should do well to protect my people around. Okay? So reporting is a step forward to protecting everybody around. Okay, then the community will do well again. Okay, to report these cases, because truly there are some cases that may be there and then they are hidden in the community. Okay, the community brings them out, because the moment we have an index case means it is the first case to be reported that has that disease.
Okay.
Once that index case is reported to the healthcare facility, the PHC will call the disease surveillance unit, and they will swing into action. And when they come to the community, it is the responsibility of the community, and especially the community leaders, to rally around them to get to the root of it. It is possible there are multiple sources of water. Okay, but how do we arrive at which one actually is responsible for this?
Okay.
And of course, that would mean that the community leaders would be important. Their input would be very vital.
Okay.
Yes.
Hello? Yes, who's on the line?
Ayuba Conde.
Okay, Ayuba from?
Ayuba Conde from Jantadem.
Okay, go ahead, Ayuba.
From Jantadem.
Yes, I can hear you.
My own advice is that they should give the children, even adults, we support to pick something, wash it before eating. Even if you throw bongo on the tree, you're supposed to wash it before eating.
Okay.
Because to avoid all these diseases.
Okay. Okay, thank you, Ayuba.
Yes, that's my advice, ma.
Okay, we appreciate you.
Yes.
Thank you.
And my colleague, Ayuba.
Okay.
Greeting Dr. Ayuba.
Okay, your namesake.
Good afternoon, sir.
Thank you, my brother.
Okay.
Thank you for listening. Thank you for your input. We appreciate.
Okay.
Okay, so thank you very much, Ayuba and Rejoice, for calling. Now, what I'm saying is the response. Now, at the community level, the community is supposed to mobilize. Talk to members of the community to report these things, to seek healthcare, not hide these things around, to report them so that attention will be given.
Hello, good evening, ma'am.
Okay, yes, who's on the line?
It's Rebecca John.
Okay, my namesake. Okay, go ahead.
The question is like this, ma'am. The doctor was talking about the rice water.
Okay.
Is it when you start poaching, then you boil? When you start poaching, then they boil the rice and give the person the water.
Okay. Okay, thank you. The doctor will respond to that.
Okay.
We appreciate you.
Okay.
Okay.
So let me just round up on what I was saying,
Yes.
then I'll answer Rebecca's question.
Yes.
So when the community reports, the healthcare facility within the community escalates, then the disease surveillance unit comes. Now, when they come, usually they close down that source of drinking water
Okay.
automatically so that it will not be spread to other people. They close down that source of drinking water and look for alternative means of water for people while they investigate. So they take water samples from the well and investigate. Then they take all people with symptoms. And that's why we are having the concept of suspected cases. We have confirmed cases. Suspected cases are people who have reported varying degree of symptoms. Okay? Who have been exposed to even these people who have the symptoms. Okay? So they are suspected. You get these people, then you isolate the source of drinking water. You buy it so that nobody goes there to drink water again while you investigate. Okay? Then of course at the facility level now, the tests are being done to confirm, is this truly cholera? Okay, while resuscitating the people who are affected, giving them medications, giving them fluid therapy to replace whatever is being lost. Okay.
Thank you. Okay, hello. Yes, who's on the line?
Hello.
Yes, who am I speaking with?
You are speaking with Goji
Okay, from where?
from your.
Okay, go ahead and ask your question.
My question is
Hello?
hello.
Yes, we can hear you. Go ahead.
He talked about and you know.
Okay. Okay, stooling. He talked about stooling.
Oh.
Okay. Okay, thank you for calling.
Okay, I'll go straight ahead and answer
Rebecca's question.
The question is it that when the person begins to pass watery stool, you give him or her rice water after you boil rice? No, it's not. Okay, you don't give the people, anybody suffering from symptoms of cholera, please don't give any rice water to anybody. Don't give anything to anybody in the name of water or in the name of ORS or whatever it is. Just report the person to the healthcare facility because it is a matter of life and death. Okay, it's a very life-threatening condition. Now, the rice water fever or the rice water we are referring to is the stool that the person passes. That watery diarrhea looks like rice water. That is simply what I mean. It is so watery that it looks like rice water. Maybe I should say it that way. Okay, you know when you wash local rice, the water you see.
Okay, so that means it is different with the way maybe a child that is teething, passes
yes, it's different.
The stool, so it looks different.
That one looks from any kind of diarrhea whatsoever.
Okay.
Usually this one, it is the stool that looks like water that you just washed parboiled for the local rice. Okay, so that's what the rice water means. But please do not give water after boiling rice to anybody.
Okay, thank you. Okay. Yes, so our number is there. We'll still appreciate more calls from you. So now with this, you said once we see something like that, we should not even begin to attempt first aid, whatever. We should report it to the hospital, especially if the stool is like rice or water. But within the community. Hello? Hello?
Hello?
Yes, who is on the line?
Is it the doctor?
Yes, go ahead.
Yes, we can hear you.
Is the lady?
Okay. The lady, go ahead. The doctor is here.
Yes. Afternoon, madam.
Afternoon.
Afternoon, doctor.
Thank you. Good afternoon, sir.
Okay, what I want to contribute here is that as far as you say that we can gather people and educate them in respect of the sanitation of the area. So if there is anything like that, where can we report the case? As you say, we should report. Where can we report? Is it in the clinic? We can take the report or where? Exactly. Thank you.
Okay. Thank you, then, lady.
Thank you.
Yes.
Okay. Thank you, Danladi, for your question. It's a very beautiful question. Where do we report to? You report to the nearest healthcare facility, preferably a
Primary.
PHC, the primary healthcare, because these people that you see in the PHCs have been trained for this. Personally, I've attended one of the trainings, and the people I met there were CHOs. They are the people who man these primary healthcare facilities. Okay, you report to them. They have been trained on these things. They would identify the moment they see it, and they know who to report to. Okay, so there are disease surveillance officers. When we say disease surveillance officers, we're talking about officers who have been trained to look for these diseases. It is their job. They are on standby almost always. 24 hours, you call them in the night, they will give you attention. Okay, so usually they are there. The people in the PHCs have their contacts. So when you report to the PHCs will now call their attention. Then they will swing into action.
Okay.
And then they would come to the community, map out the area, and begin to source for the cases, and then do the needful.
Okay. So the nearest PHC.
Yes, the nearest PHC.
Okay, yes, I was trying to find out. I said, okay, since mostly is community, by the time one case is established and maybe that person is already on medication, the management is ongoing. With maybe the way we most often behave, my husband's condition, once he begins to take the medication, it becomes my own medication too. So if it is within the community, once we begin to see this watery stool, can we just go ahead and begin to get the same medication and go ahead with our treatment? Let's see who is on the line first. Okay. Hello? Yes, who is on the line?
Hello.
Yes, who am I speaking with?
Hello.
Yes, we can hear you.
Yes, who am I speaking with? Hello. Yes, we can hear you.
Okay.
Okay.
Yeah.
So the answer is no. You cannot take medication belonging to the order. In fact, there is no medication that they will give you in the hospital to take home.
Okay.
It is that straightforward. What kills people in cholera is a fluid they lose. Okay? Remember we said that the person begins to purge.
Yeah.
You know, you have diarrhea, very serious diarrhea, profuse, large quantities of diarrhea. Very large quantities. So what do we do for somebody who is losing fluid in the body? You replace. Because the body needs the fluid to function normally. Now the fluid is not there because you are losing it. The facilities, what they do is they replace it. And they don't replace it through ORS.
Okay.
Most times they replace it through the vein.
Okay. The drip that we
Yes, because and then that is depending on the degree of dehydration. And then usually you will find out that the reason why we will not prefer to give by mouth usually is because when the cholera toxin affects the intestine, it changes the physiology. Now, by nature, by God's divine arrangement, when you drink water, the water enters your stomach, but it gets absorbed into your blood. From the stomach, it gets absorbed, it enters into your blood and, all over the place in your body. When cholera affects an individual, it stops the intestine from being able to absorb this water.
Okay.
Instead of the intestine to even absorb the water, the one that is in your body, it will push it into the intestine. So you can see everything has been reversed. Instead of you drinking water, let the water come to your body, the one inside your body is going back into the intestine so that it will be excreted inside your stool. So now let's look at it technically or logically. If you drink water into an intestine that has lost its ability to absorb water into your body, do you think it's going to help you? Likely it won't change the outcome. And that's why preferably we would prefer that the person is seen in the hospital. Then a vein and an intravenous line or a cannula will now be inserted for the person. Then drip will now be given. Okay. In a few cases, yes, you can give ORS, but most times the ORS would not necessarily suffice. And for the degree of diarrhea, how much ORS can you give that will be effective?
Okay.
Because the fluid is being lost in a very large quantity, so you want to also replace it very fast.
Very fast.
Okay, so taking it by mouth may not be as effective as giving it through the drip, as the case may be.
Okay. Thank you. Hello?
Hello.
Yes, who is on the line?
Yes, Sunday is on the line.
Okay, Sunday from?
From Abattoir.
Okay, go ahead.
Please, I want to ask, what is the relationship between corolla and this thing? This sickness?
Diarrhea, dysentery. With which sickness?
I forgot the name because they are all they have the same symptoms.
Okay. Is it Lassa?
You
Is
want
it
to say typhoid or something?
typhoid, Lassa?
Yes, they have the same. What are the relationship so that somebody will take care?
Okay, between cholera and Lassa fever or cholera and typhoid.
Yes. They have the same this thing.
Okay.
They have the same symptoms.
Okay. Okay, thank you, Sunday.
Yes, ma'am.
Okay.
Okay, Sunday, thank you very much for your question. How I wish you were a bit specific as
Yeah.
to which disease you have in mind.
Okay,
But,
let's take this call and add to it.
Okay.
Hello?
Hello, good evening.
Yes, who am I speaking with?
My name is Nancy.
Nanchin?
Nancy.
Okay, Nansir. Okay, Nansir, go ahead.
Hello?
Yes, we can hear you. Go ahead.
Hello?
Yes, Nansir, we can hear you. Okay.
Okay, so to answer the question as to the relationship between cholera and, I don't think there is actually a relationship. There are different diseases caused by different microorganisms. The only relationship we can state here is that they are both bacterial, they are both caused by bacterial agents. Okay, however, the symptoms are not even exactly the same. In typhoid fever, you may have fever. In cholera, you are not likely to have fever. You may have diarrhea in fever in typhoid, yes, but then the diarrhea in typhoid is not usually the typical rice water kind of diarrhea. You just have maybe episodes in a day. Person passes to maybe just once or twice. Okay, watery stools. Okay, abdominal discomfort, abdominal pain, and headaches, and and the rest of them. And usually it will take a while. You discover that this person is having these symptoms for a while. Most times people don't even report the symptoms, until after several weeks or several months in case of typhoid fever. But in case of cholera, we're not talking about months.
Okay.
From the time the symptom begins to manifest, I'm telling you, people die within 2-3 hours. I'm very serious. It is that serious. Okay? Because the amount of fluid that people lose is what you cannot believe. Okay, it's in a very large amount.
Okay.
We say it is about 1 liter per hour. If you lose 1 liter of fluid, you would become weak. That is what it means. So let's talk about 2 hours. You are losing 2 liters. You are losing 3 hours. So you can see how serious this is. Okay, so in a nutshell, it's not exactly the same. Okay, so it is not to be confused. Cholera is a life-threatening disease condition that is caused by a preventable bacterial infection.
Okay. Thank you. So now, one of the things you said, especially now with the rains, with mangoes, fruits, vegetables, and the likes. So how do we now eat our mangoes, most especially? Because I've seen people buy the mango, maybe try to use salt water to wash it. Do we dip it inside the salt water and wash it, or how do we wash it?
That is good, impressive. Yes, buy it, wash it inside water with salt. Not just mango, any other fruit whatsoever. Any fruit you are taking, please wash it appropriately. You wash your vegetables, okay? Any food substances that is going to go into your mouth, make sure you know the source of it. Okay, when you have your drinking water, if you are sure of the drinking water, it is a secured place, fine. If it is not, treat the water first. Okay, there are different methods of water purification. We have chlorination. We have using the use of water guard.
Okay.
I think water guard is the one that is commonly available with us. Okay, you can use water guard. You can use you can even boil it. If you are not sure of it, you boil it. Just that boiling, I don't know how much water you can boil, for domestic purposes, but yes, you boil your water, you purify it, you wash your vegetables, you wash your fruits. You don't plug mango and put it, and take it to your mouth, or you don't buy mango or whatever it is in the market and just start eating. Okay, then the next thing is your hand hygiene.
Okay.
Don't forget it. Wash your hands always. You leave your house every day, you shake 10-15 people averagely. These 10-15 people also shake another 10-15, who also shake another 10-15. What is the likelihood that your hand is actually clean? If you shook this number of people and they also shook that number of people, who also shook another number of, so you can see that we cannot overemphasize this. So what it means is, if you are going to have anything go into your mouth, make sure you know the source of it. Make sure it is well prepared. For those who are food vendors, there are people who prepare food items. Please, we are begging you. You may not be the one eating the food, but please try as much as possible to clean those things. Clean your vegetables, clean your fruits, clean whatever it is, even the plates and whatever it is you are going to use to serve or dish out food for people. Okay, that way would, go a long way. Then the other thing is environmental sanitation. We are talking about one of the risk factors we talked about that time. We said is flooding. Okay, when we clear waterways, water follows the right channel for it. It goes away. It does not carry any harmful substance for you to deposit in your water source. Okay, that way we can reduce the spread of the cholera infection.
Okay.
Yes.
Okay. Hello? Okay. The person just dropped the phone. So now for the source of water, again, maybe you might have your well, it is secured, you've been able to make a covering for it, but there is this that we commonly call it guga, that the drawer that we use to draw the water. Let me use that language so that people can understand. How do we keep it, or how do we make sure that it is also not contaminated?
Okay. When you said, something flashed through my mind. I remember when I was a child growing up, we go to the village, we fetch water, then you throw the guga on the ground. And then just by the side, the small water that had been pouring would have accumulated and formed some small water loop.
Yeah.
Then you drop it there. And then we used to match there. That is a very bad practice now, Shebi. Okay, so ideally you are supposed to, when you take your guga from a clean place, put it into the well, you fetch your water. As you are done, you tie it up. You don't drop the guga or the rope on the ground. You see people fetching water, people who know this. When they pull the rope, they don't drop it on the ground. They hold it in their hand. They keep pulling and piling the rope in their hand. When they are done, they put it and do the next one. When they are done, they now carry the whole thing as a whole and go and drop it in a clean place without necessarily putting it on the ground where you are matching with your legs. Okay? So that way you would help to reduce, the spread of. I forgot to mention earlier that always cover the wells.
Yeah.
Please. Because sometimes even children play around, they throw about objects. Some of them will even bite the mango and throw it inside the well. Then it will go there with the cholera virus and bacteria and go and decay inside the well, multiply, and then it becomes a problem eventually.
Okay.
So as much as it depends on you, I would always say this, and I won't get tired of it. Nigeria is not healthy enough. It is better to prevent a disease than to have to bear the cost of managing it. The cost does not necessarily mean money. You may have the money, but you do not have everything it takes. Everything is not necessarily in your power. As much as it depends on you, try and stay healthy.
Okay. So so far so good with this cholera outbreak that we now have. What will you say is the response like?
The response so far has been good. I will be honest with you.
Okay.
That when I called the public health director, he was like, he's getting updates, as he's on his phone, he's getting it. He's like, what is it? Update just entered a few minutes ago, and this is the updates. So they are on ground. Of course, the cases have been isolated in Plateau Specialist Hospital. There's a place there, and of course they are doing lab. They are culturing the stool sample of people who have been suspected already. So yes, the response so far has been encouraging and it's good.
Okay.
And of course, we will not say we've gotten 100%, but we'll encourage people. Everybody, all hands should be on deck to ensure that this is taken care of.
Thank you.
Thank you.
Yes, so the outbreak of cholera on the plateau, and so far so good. We appreciate every effort that has been made, because there is a great effort in terms of response, and so we want to keep it at that level. We don't want more number of people to come down with cholera. That is why we've decided to make sure that we give you every information that you need, especially concerning preventing it. Be sure of your source of water. For those vegetables, cook it. For those fruits, make sure you wash it properly. If not, forget about taking any of this. So that has been the package today that we've been able to bring to you concerning cholera outbreak, and we sincerely appreciate Dr. AYUBA NAMANG JEHU, who is a resident doctor, Department of Anatomic Pathology and Forensic Medicine, Jos University Teaching Hospital, and he's also the Public Relations Officer of the Nigeria Medical Association, Plateau State. Indeed, we are very, very grateful.
Thank you for having me.
Yes, and to all of you that got across to us by your calls, by your comments, asking questions, we are indeed very grateful, and we say keep your environment clean. So on that note, on behalf of the entire production crew, it's yours sincerely, Rebecca George, saying goodbye and God bless.
So beautiful, beautiful, our land.
Plateau, the beautiful cradle of the Middle Belt, a land of heroes, a friend to everyone. North, south, east, and west, a land of great wealth, rich in food and rich in livestock. Tourist delight, a state so enduring.